Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to talk about crying as a new nurse. So in my previous video I talked about crying during nursing school, which is something that many students experience. However, crying just doesn't end with nursing school, and many new nurses find that they are struggling with the same issue. Now, many nurses really don't like to talk about this issue because crying makes people feel weak and vulnerable. But nevertheless, this happens. So I want to talk about my personal experience with this and hopefully give you some tips on how to deal with this issue if you are going through this as a new nurse. So first off, why do nurses cry? Well, nurses can cry for many reasons. For instance, nurses see and experience some really traumatic and sad events that can take a toll on your mental health over time, which leads you to cry. But one of the most common reasons that nurses cry, especially new nurses, is that they feel very overwhelmed. They feel like they have too many tasks to do and can't focus on that individual patient, which makes them feel like they're going to miss something important. In addition, they feel that they don't have enough resources or staff to give good care, which leaves them with limited time to do nursing tasks, plus not even mentioning all those little unexpected things that pop up during the nursing shift that you have to address. Therefore, it can leave that nurse feeling really stressed about liability issues and doing something wrong. So the nurse may begin to question themselves and think, how am I ever going to get through this? Will I ever feel better about my career in nursing? And did I make a mistake about becoming a nurse? So whenever you're facing all of those issues, it can really leave you in tears at times. Now, some of you may be wondering, did I cry or feel overwhelmed as a new nurse? And the answer to this is absolutely, I did. I would say for me, that first year or so, I'm transitioning from student to nurse, and I'm just learning how to be a nurse, how to think like a nurse, and take care of patients. So I would remember after those 12-hour shifts as a new nurse, I'd be walking away, gonna go clock out, and literally my head would feel like it was just going to explode because there was so much that went on during that day, so much interaction, so many crazy situations, and I would just feel like I couldn't take any more in. And I would hear like phones ringing, alarms going off, from the cardiac telemetry monitors, and I would hear people say my name, Sarah, Sarah, and I'm just like, whoa, I would feel so overwhelmed. And I would remember thinking, how am I going to remember all of this? Because I would see other nurses, granted they had been there for many years, and they were just like doing everything and getting it all done. But here I am new, just learning the way, and I'm thinking, how am I going to remember all the prep that I'm supposed to do for this procedure, or all the things I'm supposed to monitor for while they're on this medication, or what papers go with this. And it was just like, how am I going to get this all in my head? Now let's shift gears and let's talk about how to cope as a new nurse. So the first thing you got to do is you've got to realize that these feelings are common. I won't say every single nurse goes through this, but I can tell you that many new nurses go through this. In fact, this is why many hospitals actually have residency programs in place to help new nurses have a smoother transition and adjust. Because the thing is that starting a new job is really hard and there's a lot to learn. So know that you aren't just some loser or failure if you're feeling overwhelmed or you're crying, because these feelings are very common that a lot of new nurses have. And then the next thing is that you don't want to give up too soon. And I have seen many new nurses who get really overwhelmed with their job that they quit within a few months. And in my opinion, I think that's just a little bit too soon. You want to give the job a chance. So try to stay there at least a year or so. And if you find that you're still struggling, you may want to consider a different floor or a different specialty of nursing that fits you a little bit better. Because the thing is, it takes a lot of time to develop that confidence as a new nurse and learn the protocols of the facility, get familiar with staff, and so forth. So if you can wait for a full year or more, you'll find after that time that you feel much more comfortable with the job. And after 2 to 3 years, you may find that you feel like an expert compared to what you felt like before. But the thing is, you got to remember, you may still have bad days, but you'll learn how to cope with those bad days better. Next is to find another nurse to encourage you. And this really helped me cope as a new nurse because fortunately I was blessed with a lot of other experienced nurses on the floor with me who were just very helpful and were always there trying to offer encouragement. And I remember I would go to them many times and say, okay, what should I do about this? Is this right? Or, if I felt overwhelmed, I would say, am I ever going to get this? And they would be like, yes, you're going to get it. I felt the same exact way whenever I was at this stage in my nursing career. Just hang in there. And they were right. I just had to keep with it and just keep doing it. But their encouragement and positive attitude really helped me. Another thing what you want to do is you want to take these emotions that you're feeling right now, the feelings of feeling overwhelmed and stressed and crying, and channel those into improving your nursing skill set. So there's nothing wrong with having a good cry, but you want to pick yourself up and you want to look and say, okay, how can I make myself feel less overwhelmed? What can I do to make this situation better? For example, let's say you don't feel confident in a certain area. Well, you want to spend some time on your off days researching it as much as you can. Go back, review textbooks, watch videos, research medications that you're commonly administering or diseases that you're encountering on the floor just to help you feel more confident in it. And then also look to see if your facility offers any courses on these topics. Sign up for them and then go to the class and just try to absorb as much as you can so you can take that back to the floor with you and feel more confident. And then another thing that can be really helpful is working on organization and time management. Because one thing I figured out very quickly as a new nurse was that there is a major importance on time management. If you want to get out of there on time and make sure you get all your nursing tasks done, you've got to manage your time very wisely. So what I did is that I would set these little mental time goals. For example, I would say, okay, by 9 o'clock, I want to make sure that I have performed all my head to toe assessments, that they're documented, and that I have pulled my medications for the 10 o'clock medication administration rounding time, and that I'm in the process of giving those. And if I was doing that by that time, it was a good day and I was staying on task and things were going smoothly. But the thing is, in nursing, that doesn't always work. But if I was close to that time frame, it was good. But by just setting these little goals, it helps you stay on task and be more productive, and it can help manage your time. And then lastly, if you need help, get help, because there is no shame in asking someone for help. Because if you find that you're experiencing deep sadness that you just can't shake, you want to get some help. And this is especially important if you're feeling like you just can't cope with life, you're having symptoms of depression, or you have thoughts of suicide or self-harm. So just to wrap things up, if you're a new nurse and you're in that first job, but you're feeling really overwhelmed, you're crying a lot, and you're questioning, did I make a mistake becoming a nurse? Just know that many other nurses have felt the same exact way. I felt that way. Other nurses I've worked with have felt that way. So don't cut yourself too short by giving up and leaving the profession. Give it a little bit more time. Take it day by day. Because over time, when you look back, you see that you're improving, you're feeling better, you're crying a lot less, and you feel less overwhelmed. So I hope those tips helped you, and thank you so much for watching this video. And if you'd like to watch more videos with more new nurse tips, you can access the link in the YouTube description below.